Good afternoon and good evening to everyone. Welcome to the first episode of a three-part webinar series that we're calling the HVTN Community Cafe. For those who are new to us, the HVTN stands for the HIV Vaccine Trials Network. And we're conducting this event in collaboration with the COVID-19 Prevention Network, or the CoVPN, the Black AIDS Institute, and the Treatment Action Group. My name is Francisco Rentas. I am a Community Engagement Project Manager for the HVTN and the CoVPN based in Seattle, Washington. So why are we here today? So as far as we all know and have experienced, the COVID-19 pandemic has had a profound impact on many communities, including Black, Latino, and other communities of color, as well as our trans communities. And so we recognize that these same communities are also vulnerable to HIV and other chronic health conditions due to structural and systemic racism, homophobia, transphobia. So in this session, we want to discuss the impact of the COVID-19 pandemic on Black and Latino LGBTQ plus communities, including what lessons we've learned from our work in HIV that have informed our COVID-19 response. So to do this, we've gathered a group of panelists that represent a wealth of experience and knowledge in HIV prevention work, advocacy, and community engagement. I'm very excited to welcome them. Before I ask my panelists to introduce themselves, just a quick announcement. We will be inviting you to ask questions during the course of the webinar, but we simply ask that you keep in mind that we'll hold the questions until the end, roughly about 20 minutes worth of this 90-minute event. Just pointing that out to manage expectations, and you might find that your questions are answered throughout the course of the panelists' conversation. We'll try to get to as many questions as we can in the time that we have. And so now I'd like to go ahead and ask my panelists to introduce themselves. Why don't I begin with Rafael Gonzalez in San Francisco.
Hey everyone, good afternoon, good evening, good morning, maybe happy hour. I'm not sure where you are. My name's Rafael. I am the Community Programs Manager at a clinical trials unit in San Francisco with the San Francisco Department of Public Health. Been working on HIV prevention research for about 7-ish years. And then for the past year, it's been kind of amazing. Well, the pandemic hasn't been amazing, but it's been amazing and a privilege to be able to work on finding a way to get life back to normal with the COVID-19 pandemic. So happy to be here.
Thanks, Rafael. Jamel, hi.
Hey, greetings to all. What's up, everybody? My name is Jamel Young. I am the Research Administrative Coordinator for Emory School of Medicine Clinical Research Unit, I have been with Emory just short of 1 year, but I've been the community ambassador, community educator for HVTN for maybe about 2 years now. So I've been working with this team amongst a large group of other people, learning and growing and just really excited to be a part of history. Let's get it, y'all.
Thanks, Jamel. Abraham, how are you?
Great. Hello, everyone. My name is Abraham Johnson. I'm the newest member at TAG, where I serve as the HIV Community Engagement Officer. Only been working at TAG for about 3 months, but I've been working in the field of HIV since 2013, and it's been a ride, and I really enjoy my work and happy to be here, and thank you for having me.
Thanks, Abraham. Keith.
Hey, good afternoon, everyone. Thank you all for tuning in. My name is Keith Richardson, and I'm the Community Engagement Coordinator at Vanderbilt University Medical Center. I work in the HIV vaccine trials, and I've been doing that work for about 4 years now. So I'm just excited to be here with these great panelists as well.
Nice, thanks, Keith. Hey, Max.
What's up, y'all? Max Boykin, he, him, his pronouns, the policy and organizing manager at the Black AIDS Institute. Just celebrated my 3 years at BAI, and have been working in HIV about 5, almost 6 years, and been organizing over the last 10. I'm excited to talk to y'all about some of the lessons that we've learned and what we're going to continue to do about it.
Thanks. Last but not least, Dr. Stefan Wallace.
Hello, everyone. Stefan Wallace, he, him, his pronouns as well. I serve as the Director of External Relations for both the HIV Vaccine Trials Network and the COVID-19 Prevention Network, and heavily involved in leading community education and stakeholder engagement activities for the networks globally. Look forward to the conversation. Let's get it.
Thanks, Stefan. Well, let's go ahead and start with you, actually. Let's kick off the conversation by laying some groundwork. So Stefan, what is COVID-19 exactly? We keep hearing all these different words, SARS-CoV-2, coronavirus, and then also, is the impact of COVID-19 the same across all groups of people?
Yeah, simply put, COVID-19 is the disease that comes about as a result of acquiring the virus SARS-CoV-2, severe acute respiratory condition, and it is a coronavirus based. So no, everyone isn't impacted the same way, but we're all impacted. We're feeling the brunt of this on a economic level, for people who are stably housed, there's a disproportionate impact there. And then of course, we're seeing disproportionate impacts in communities of color broadly, as well as older adult populations who are bearing the brunt of a lot of the hospitalizations and deaths. So COVID-19 is, again, the disease. SARS-CoV-2 is the virus. And happy to continue on this, to talk about more about this.
Yeah, well, speaking of how it is impacting various groups of people in various communities, all of you are in different parts of the country. So why don't we go ahead and talk about how COVID-19 has impacted your communities specifically? Why don't we kick that particular conversation off with you, Abraham?
Sure. So I am a Southerner. I reside in Durham, North Carolina, but I'm originally from Albany, Georgia. So when people think of Georgia, they instantly think of Atlanta. But no, there's Albany, Georgia, not New York. So I recently got a chance to travel to Albany for a funeral. And Albany already had a declining economy. And I think that COVID-19 just put the icing on the cake as far as jobs go. Also, the way of life. When you think about more rural settings, they rely heavily on essential jobs. And now with restaurants being closed and the way people congregate, even my grandmother's funeral, of course, things look differently. So COVID-19 looks different in South Georgia compared to Metro Atlanta, maybe even Houston, Texas. So in rural areas, they're really facing it. We're in this digital age, we rely on technology so much. In places like Albany, we have internet, but a lot of people don't always rely on Wi-Fi or Zoom to get on a call for work. So it's definitely having an economic impact in rural Georgia.
Interesting.
How about in some urban areas then? Raphael, you're in San Francisco, right?
Yeah, so in San Francisco, Bay Area, and things have drastically changed in the last year, obviously. Prior to the pandemic, people that were native were having to move out, because San Francisco's just gotten ridiculously expensive. Since the pandemic, there's been a mass exodus of like all these people that came to San Francisco. I actually work kind of close to the Twitter building, the Twitter headquarters, and around there's different really fancy apartment complexes. And in one of these buildings, there's over 200 something units that are empty because everyone's just left. Aside from that, the Latino community in particular here in San Francisco has been hardest hit. Latinos actually make up over 50% of COVID cases in San Francisco alone. And that's kind of the same in California as a whole, but in San Francisco specifically, it's like 55%. Specifically, there's a neighborhood, the Mission District, lots of Latinx presence, and it's actually the neighborhood, it's the densest census tract. So heavily populated, and we are seeing most of San Francisco COVID cases coming out of this neighborhood in particular. Lots of multi-generational households, and just lots of poverty, unfortunately. So unfortunately, people are dealing with a variety of issues as it is. Rent's been difficult, and now so many people have lost their jobs, some of my own family members included. It's just hard to even focus on like which issue is the one to focus on, right? Because there's such a domino effect. When you lose your job, you know, then we're talking about income, mental state, lots of tragedy going on for sure. San Francisco feels like a really eerie place right now.
Yeah, well, those two actually. Keith.
Hey, Francisco, I'll go ahead on and
Yeah.
give a stab at it. So I know in the South, I'm in Tennessee, so it's very country and rural here. So in Williamson County, it's like a very conservative city. So they don't believe in wearing masks. And the majority of those individuals who live in that county, unfortunately, have contracted COVID. So there you go figure. So, but more so in the city of Nashville, we're in a more like liberal area. So people are abiding by the rules. We do have some businesses and bars that have closed down. Nashville is considered a very popular city for like bars and weddings. So a lot of individuals have not come to Nashville because of COVID. But as far as impact of the city, I would say it's about the same across the board. We haven't experienced vacancies like Raphael has, but we have definitely had some people who've been very conscious about going downtown, surrounding themselves with individuals. So I think that's way across the board.
Yeah.
So here in Georgia, I feel like we're in a time where Atlanta is really, really thriving. And so I feel like the city's having a hard time with wanting to close things down. People aren't wanting to be stuck in the house. They're wanting to engage in different activities. And there are lots of things to do here in Atlanta. And I feel like that's reflected in the numbers, with Georgia at like 862,000 cases and with like 13,000 deaths. Fulton County, which is the main like inner city county itself, has like 75,000 cases, almost like 1,000 deaths. So I think that is very much so reflected in the numbers. And it's a bit unfortunate that our people aren't taking it very much serious. Because in addition to things still being open, there are lots of people that aren't masking up either. So yeah, it's lots of work to do here.
To go off of what D. Jamel just said, I think when we think about Atlanta, we got to think about the different economic engines that make the city run. And for a lot of our different places, you know, there is a sense of when some of your capital is based off of not just nightlife, partying, but also the just transportation that goes in and out of the city, it being the heart of the different parts of the South, and many people needing employment within here also to have access to it. And thinking about truly what is an essential worker. Grocery store workers, the fast food workers, the folks who are working on the streets, making sure that the regular day-to-day things that are working, especially when the state does not and tends to avoid any type of real lockdown, then adds to our frustration and ability when we see the rollouts of either the vaccines or even how in which we are giving proper information around COVID-19, we have seen failures from our locally elected officials to our also state elected officials by not actually following the science and trying to give the best guidance for our folks to be able to move forward and be healthy.
Yeah. Does anyone else have anything to say about their communities that they want to add? So, I mean, it's clear, obviously, that all of our communities across the country are being impacted. A lot of similarities and differences in how our various settings are being impacted. And what we've seen in the past year, on top of dealing with all these impacts, is we've seen the race for the COVID-19 vaccine, and we've seen in the time span of less than a year, going from not having a single method of prevention to all of a sudden having a couple of vaccine products that now have emergency use authorization, getting close to approval, people are being vaccinated. And this all happened, again, less than a year. So what are you hearing in these communities that have been so hard hit regarding how quickly COVID-19 vaccine research has been done in contrast to HIV vaccine research, which has been going on for more than 30 years?
Yes, and I'll go ahead and start us out there. Like, what the heck?
Muted.
Oh my goodness, I'm so sorry, Max. Yep, there you are.
Is no problem. They were like, what the hell? How did we get here? How is it taking so long for HIV with the different amount of resources that we put in to compared to COVID, which we got in less than a year? And even one of my friends reminded me yesterday, he's like, originally everyone said it would take at least 2 years to even have this done. How did we get it so fast? And for many people, this is the first time, I think, especially if they're outside of the typical research spaces within HIV, that they've even heard that a vaccine, how long a vaccine even takes. And then to hear that this vaccine was created in a much shorter time, and you're going to tell folks, oh, there's no side effects, it's all good to take. When we've seen for years all these drugs commercials that all have these like list of side effects that we hear at the end, and then we hear about the lawsuits later on. And folks are definitely worried. There is a fear, a distrust that also comes from it, especially when you think about the political turmoil that we have been through over the last year in the United States. We have to think about, like, okay, who am I supposed to trust? Am I supposed to trust the science? Am I supposed to trust the politicians, the elected officials that are supposed to represent us? Am I supposed to trust what my community, what my folks are telling me, or the conspiracy theories that I'm seeing on Instagram? Which one am I actually? And many times folks are like, well, what is the trusted places for us to go? And I know many of our sites here try to be those trusted places for folks to be able to get proper information around the vaccine. But I completely understand where folks are like, whoa, how do we get this so fast? And on the other end, I feel like I need this if I want the world or for myself to go out, for the world to be out and doing normal things. But there's a lot of stuff that I still don't know. And unless we do a rapid uptake of how in which our communities are seeing and understanding vaccines, we're not going to get to that place where folks are trusting.
Yeah, 100%, Max. I definitely know, right? Like, we can be receiving the most accurate information, but at the end of the day, I don't know that person on the TV. My auntie needs to be the one to tell me, or my sister, or, someone in my immediate circle. And I think that's kind of been part of what contributes to the misinformation, right? Where my auntie's friend told her some wild conspiracy theory about this. She tells me about it. Obviously, right, I work in this field, so we go back and forth, and she is convinced what her friend told her is right. And even though what I'm talking about is based on science, it's not the trusted source. So in terms of, how do we figure out how to diminish this misinformation, I think we really need to focus on this kind of like family unit, friend unit. Really, like, word of mouth is most powerful.
Yes, and if I could jump in, Raphael, when I was home, the vaccine conversation came up, right? So the first thing my cousin says, she's like, how was they able to get a vaccine for COVID? They don't have a vaccine for AIDS. I'm like, oh my God, there are two different types of viruses, number one.
Totally.
And secondly, she actually had COVID, and she's convinced that COVID is created. She's like, no, this is a population control. And meanwhile, she's telling people in my family, like, hey, you all don't wear a mask. That's not real. I survived COVID. And something that Max said about trust, right? So right now, people of color, Black communities, I don't think we have a trusted source, right? Because based off the political climate, it's been really, really weird to really believe what we hear on the news about COVID. And, when you look at the numbers, people who are most disproportionately impacted by COVID are African Americans. So it's like, it started out as this disease that impacted everyone. And now, unfortunately, Black people are facing the burden of the disease. And that seems to be the trend with all diseases.
Yeah, and since you brought it up, Abraham, I just wanted to mention, right, this conversation about like, how is it that we already got to COVID vaccines and we still don't have an HIV vaccine? And like Abraham said, they're totally different. And the way I've been thinking about it lately is like, you know, you think of children, right? Like, I'm in my 30s, so I'm as old as HIV is. In my 30s, I'm probably a bit harder to change my ways, you know? But when you catch something in its infancy, when it's very, very young, you can identify what its traits are. They're much more simple, and you could possibly correct them or change them. And so this is where we're at with like COVID being in its infancy and HIV. HIV has had lots more time to develop and change. Those are mutations, right? That we're now starting to hear about regarding COVID on the news. So up until now, COVID-19 hasn't really mutated. Now we're starting to hear about mutations. But HIV has had 30 years to morph and change. And this is one of the fundamental reasons why we haven't been able to get or find a vaccine for HIV, because it's become a really complicated virus. And COVID-19 is still rather premature, it's infant. I mean, we still need to figure out how it works, but we've been able to apply a lot of these principles of getting to know HIV over the last 30 years to getting to know COVID-19 or the coronavirus quicker.
So much of our experience in other disease areas, HIV, SARS, and MERS, and the coronavirus one, has informed our response to COVID-19, particularly when you think about the clinical trials. I think that expertise and that experience is important to highlight, and I think it's important to repeat, because we did not start from ground zero in terms of our response to COVID-19. We started from a privileged place of having experience working in other diseases, other viruses, and how we've been able to retool and repurpose the ways in which we have attempted to address those other viruses using some of those methods for COVID-19. So the design, the vaccine designs that are being tested for COVID-19 are not new vaccine designs. They represent, vaccine designs, as I said, that have been used in other areas. And so we're basically taking information that we've gained before and say, hey, can this work in this setting? And it just happened to have worked. Being able to conduct two different clinical trials, the two different phase 3 trials, Moderna and Pfizer, and to see virtually similar results in terms of efficacy is amazing. And to see both results above 90%, I think is really, really amazing as well. So in addition to all of the ways that we have understood how to work together, how to work collaboratively, how to work within the different agencies and groups working on clinical trials, have informed our approach to this as well. We have a harmonized, independent group of experts reviewing the data for these trials called the Data Safety Monitoring Board. Typically these boards meet once every 6 months, and they have one for each study. Well, we have one for all of the studies, and they're meeting like once or twice a week. So there's an impetus to really respond to and get to an answer to the question of whether or not these vaccines work. And the goal isn't to move so quickly that we circumvent safety processes or that we cut corners in terms of how we think about the conduct of the trials, but that we move expeditiously through minimizing red tape and bureaucracy, to be honest, in order to ensure we get an answer as quick as possible to respond to the pandemic.
I've heard a lot of really great insight from all of you in terms of sort of the why behind such a fast COVID response versus what we've seen in HIV. At the same time, I know I'm not alone in feeling that our communities, in a lot of ways, feel that HIV has not been treated as important as other diseases like COVID, and that the COVID response was so fast because it affected everyone globally, as opposed to what people believed were just certain people back when HIV was emerging. And so, is there a way to hold space for these people who really think, believe that HIV is just not treated as important, and really acknowledge that as a real thing?
I think more than anything, Francisco, it definitely puts it to the forefront that HIV work is definitely necessary. With COVID and the vaccine development, I think that will help push science a little bit more forward. People will be more open to HIV vaccine treatment versus something that they're afraid of, because in my theory, people fear what they don't understand. And that's why it's important to continue to have these conversations like we're having today, so people are aware of these vaccines and research.
I believe there's a stigma around who is impacted by HIV that allows for folks to differentiate. I think we have, through our time in COVID-19, we have not known exactly who would be impacted the most. We are learning more and more of who is actually most impacted by it, different people living with comorbidities, and then learning even which comorbidities are most impacted by it, and also understanding how it disproportionately impacts people of color. But years and years of stigma and really harmful hate towards people living with HIV has caused for that less care, especially in the United States context.
And Max, I had to jump in when you start talking about stigma, and I think when people think about HIV, they instantly think of sometimes Black gay men. I think of the LGBT community, right? And there's a stigma associated with being Black and gay and like contracting HIV, right? So in terms of COVID, as Raphael mentioned, Keith mentioned, it impacted everyone, right? So I think that when in terms of lessons learned of how we look at the pandemic and HIV is that there's stigma associated with HIV as well as COVID as well amongst African Americans.
And I would actually say, like, on a massive scale, right? There's stigma all over the place. Like when HIV was first coming about, it was called GRID. It was gay-related immune deficiency. It was the gay disease. Sorry, phone's ringing. It was the gay disease. Meanwhile, now we're still kind of figuring out where exactly this came from. But when it first started, when it became, something on all of our radar, folks were referring to it as the Chinese virus. So it's always like, who did this? Who's the one that brought it over? Who started this? So it's interesting how the patterns are like nearly identical, right? Again, hopefully from lessons we've learned from the past, we could go through this cycle a little quicker and it not be this 30-year process, but it's interesting how we're seeing a really similar cycle.
Right. At the same time, I don't want it to make it sound like in the past 30 years, nothing has been done, because at this point, there are many HIV prevention strategies that are available. We have PrEP. We have different kinds of PrEP. There are various forms of injectable PrEP that are being studied. And just this past week, we found out that there's an injectable treatment for HIV that has been approved. So a lot has been happening, even though there hasn't been an HIV vaccine that has been approved yet. So with so many of these prevention strategies currently available and still being studied, why should vaccine research specifically still be considered important going forward?
I'll start. Yeah, so thank you, Francisco, right? There has been tremendous progress in the last like 10 years specifically with HIV in treatment, in prevention. You know, now we have a pill, you take it once a day, and it protects you from HIV. But it's still so important to find a vaccine because while we have a one pill a day, honestly, some people don't even remember to brush their teeth every day. Sometimes they won't remember to take their pill every day. And we are working on finding other, options, like an injectable form of PrEP or just other forms, because what works for one may not work for the other. Ultimately, though, with a vaccine, in theory, it would be a one and done thing. You don't have to worry about it. Or it would be something that you wouldn't have to worry about on a daily basis, right? Like, even if it was a vaccine that lasted a year, 5 years, 10 years, sometimes with certain vaccines, we need to get boosters every 10 years or something. If it's just an injection every 5 years or 10 years, and you don't have to worry about, did I take my pill today? Huge. I mean, not just for like public health in general, but like in terms of like peace of mind, if I don't have to trip off of this for 5 years at a time, it honestly would change my life for a variety of reasons, right? Like my physical health, my mental health, I'd be in a really different place.
And not only that, Raphael, too, we're looking at on a global scale as well. This is not just for LGBTQ people, individuals. We're talking about women in Africa, in other countries. So it's very important to keep that conversation going. Vaccine research has been around for years. It's just unfortunately HIV has been placed on the back burner. So now we have an opportunity to put it on the front burner. Now let's get that eye cooking. Let's get these conversations and these uncomfortable conversations talked about.
One of the things that COVID did show is when the entire world has to focus on something, they can also try to make something happen faster. I still don't think it was the most coordinated world response, but it was still a response to the pandemic was happening. And we have lost that within the global understanding of HIV. I think because, there are some countries, especially wealthier countries, that just don't spend as much resources towards it. And those are things that we can also advocate for and continue to see more change in the future. And we can also say, I think the importance of vaccine research, when we talk about ending the HIV epidemic here in the United States or even globally, and correct me if I'm wrong on this, I don't know any infectious disease that has been conquered without a vaccine. And so thinking through having something there to get us to that closer to that level, that is the big thing that can also get us even closer to the ultimate goal of ending the HIV epidemic, of having quote unquote AIDS-free generations in the future, is getting us to this point and doing the research to it and adding it to the already toolbox that we're creating of preventing from new people living with HIV.
We've seen the impact, and that's a really good point, Max. We've seen the positive impact of vaccines in several different diseases, polio, smallpox, to be two. And, for a while, we saw reduced numbers of measles, mumps, and rubella in many communities as well, until recently, I would say the last 5 to 7 years, where vaccination campaigns had sort of scaled back and people weren't getting vaccinated for MMR as much. And so we saw a bit of a resurgence of those, particularly measles and mumps. And so there is a precedent, there is history here to show that vaccines can, in fact, not just reduce disease burden, but also save people's lives. I mean, many people are walking around now not even thinking about smallpox and polio because they don't have to, because the vaccines did what they were supposed to do.
Really great point. So in essence, vaccines are still needed for HIV. It's research that definitely needs to continue. So considering that, going back to your communities again, your individual communities, I want to hear a little bit about some of the challenges that you've been experiencing with engaging your communities in clinical research, in particular, our HIV clinical research.
I can chime in on that.
Yeah.
So being a community advocate, primarily in the transgender community, we're talking about a community that is known to be disproportionately impacted across the board. And we're talking about a community who thrives off of community, needing to be around each other, needing to have engagement. And that is the main way that they receive their information and also connect to their trusted sources. So it's been challenging working in clinical trials, trying to connect to communities and not being able to find them. And also, it's difficult trying to introduce clinical trials without being sensitive to what other social determinants these groups are dealing with. So, before I can shove down your throat, come to this study, talking about homelessness, talking about poverty, talking about no jobs, no money, no hormones, things like that, are all the different areas of how in which the transgender community has been impacted. Access to care, access to housing, food, jobs, all these different things. And at the very last bare minimum, what I've seen is that my community wants to hold on to their joy. It's been a bit difficult for my community to feel like masking up, or I don't want to party, and canceling balls and things like that, that brings them joy in such a chaotic world in which it feels like we're kind of used to. So yeah, it's been quite challenging, and definitely taking a more digital approach. And even then, communities have been moving around. It used to be where 1 or 2 apps used to be where mostly everybody is, but since COVID, everyone's been moving around. So it's been challenging just to even meet my community where they are, because it's hard to figure out where they are.
Damn.
That's a good point. I mean, there were always challenges to engaging people in clinical research, and before the COVID pandemic, and now there are new challenges on top of those. What other challenges are out there?
I would say another challenge, Francisco, people are just trying to survive too, to be honest with you. Just day to day, like I have conversations with some of my friends in our group chats and stuff, and they just are really having a hard time, the socializing, being stuck at home. So everybody feels like we're living in a different world. And I feel like we are at some point, and I hope and pray that we'll be able to get back to some type of normalcy. But a lot of people are still, feel like they're stuck. And I think that shouldn't hinder people from getting out or learning about research, because it's still important. It's one of the forefront things that we need to, push forward. But that's been a main struggle. I know in our clinic, some people just feel uncomfortable with coming to the clinics and the hospitals. Now instead of us doing in-person education sessions, everything is virtual. And some people actually enjoy that versus coming all the way to hospital, putting themselves at risk and touching things like that. So that's been a small barrier, but we're still making it.
I think it's really important to sort of dovetail off of what Keith said, and really to dig into what D. Jamel said, that we cannot do this work in any meaningful or ethical way without really looking at, considering, and centering the real social and structural factors that have impacted people's lives for generations. The way that white supremacy and racism continue to impact communities of color, the way that white supremacy is weaponized, the way that Blackness is weaponized in this country. We've had quite a bit, over the last year of multi-level, conversations, and many people are referring to this as sort of reckoning. have mixed feelings about that term, but the unarmed killing of Black people continues in this country. I heard about a story of the police officer who body slammed the Black high school student in Florida and knocked her unconscious in doing so. And this is a high school student. This is a minor. And this kind of behavior and this kind of perception about who is worthy of grace and the way that white people continue to be given grace in this country, allowed to allowed to conduct themselves as terrorists on domestic soil and walk away with almost near impunity. And I just immediately think about the kid who walked into the church in the Carolinas with the intention, to murder everyone there, walked out of that situation and was taken to a fast food restaurant so he can get some food on his way to booking. Like, there is a real way that people of color, and particularly Black people and Indigenous people, are viewed in this country that needs to be addressed. And the longer that the systems and policies in this country continue to support, the way that we're viewed, the way that we're seen, the way that we're engaged, and we will continue to see an uphill battle in the way that all of this works. So I think part of our efforts in engaging our communities is not just in recognizing the reality of these conditions, but also figuring out ways that we can mobilize and strategize to respond to these situations. As I mentioned before on a prior call, I think what happened in Georgia regarding the state elections is nothing short than a masterclass waiting to be taught. And I'm really interested in seeing how we might be able to mobilize communities, particularly Black and Indigenous communities, and Latin and Hispanic communities, to understand that we do have power, we do have a right, and that we need to assume that right.
Very powerful, Stefan. Thank you.
Just want to add,
Yeah, please.
I'm sorry, just wanted to add one more thing, because I was thinking about actually an experience I had today. So one of the challenges is trying to give so much information in a very small amount of time under crazy pressure. So today I was doing recruitment at a COVID testing site. And in addition to social distancing, trying to give information to people almost with an elevator script, walking with them as they're trying to get to their car. It amazed me how afraid people are of just even the conversation. So much that, as I'm again, trying to give the flyer, trying to tell her the spiel about these 2 studies, speed walking with her, the moment that I mentioned COVID vaccine, she literally ran away from me. She literally ran away from me. And I'm just like, wow, like that's discouraging even in itself. And it just almost makes you feel like, what can I say to people? I don't want to scare them off. And it's just, it's just a challenge I have yet to really figure out for myself. There's so many different ways to approach different people, or even another COVID testing place. I was going to surrounding areas and just encouraging people to come and get tested. Like, hey, we got free testing over here if you're interested. And everybody over there had on no mask, and they weren't afraid of each other and standing around them. But when I came over with my PPE, they looking at me like I'm the crazy person, or like I'm the person that's going to give them or get them infected, or like I have 2 heads, or it just amazes me what this mistrust does, or what the lack of information does. Like, it just really distorts our community's ability to approach this in a way that's going to help in global approach. I don't know, y'all. We got to figure it out, though.
No, I want to touch on it. I think there's like 2 types of folks that are dealing with this. Folks that are hyper-focused and trying to understand, what is COVID-19? How is it impacting my life? Why can't I go outside? What are our chances of getting it better? Trying to check up on the news, getting and seeing the updates, and also trying to I got friends of mine be like, what does this new strain mean, Mac? Like, what is this one? We just heard it came out in South Carolina, those pieces. And then there are the individuals who don't want to talk about it, want to act as if it is not even here, and are so afraid to interact with it because there's just the like, I don't want to say the wrong thing. I'm doing the wrong thing. This issue is very like, it is all consuming, and honestly act almost as if it is not there. And that is, it sometimes comes from trauma, comes from different levels of how people have been impacted by this, and also different lies that folks have heard around it. But there's almost sometimes this divide, right? Just some folks are really taking a notice of it, trying to do the proper procedures, and other folks are like, if I act like it's not here, it'll go away. And that is the fight that we're also dealing with when engaging with any community, and especially folks, when I think of the Black Treatment Advocates Network, is folks that have been pulled heavily to work into this work and trying to deal with it on their what was a 9 to 5 now is potentially a 9 to 9 with added COVID responsibilities, to be able to deal with all these moving pieces with a community that has also communities that have fundamental distrust of what is even being said right now, for all the reasons we've already discussed. But to Stefan's point, using some of that as also motivation to create change, and have folks say more and do more around how in which they can help each other. As I think about the mutual aid that has come out because folks weren't getting support from other forms of creating forms to support one another in order to make it work. Because our folks have been doing and living through many different types of either pandemics or systemic issues, and trying to make a way. And in many ways, we've had to do it again. What we would like for our government to actually help us in trying to live through this scenario.
And I'll hit the nail on the head. I mean, clearly, for all the reasons mentioned, there is just so much distrust of the medical community and medical research. It makes perfect sense. So I want to get a sense from all of you as people who work in this field. What kind of things have you done in the past that to sort of help foster this sense of trust in the medical community and medical research? What can you possibly do to try to build that back again?
So Francisco, number one is to always provide factual information. I think the worst thing you can do to a community that has already mistrust is to provide misinformation. And not only do you provide factual information, but you do it in a way that is digestible. When giving out study results of when the vaccine becomes available, making sure we do talk about the side effects of the vaccine. Don't just glance over that and say, hey, take this vaccine. No, I want to know as much information as possible so I can make an informed decision for myself. And also I can tell other people about why I chose to do it. I can provide accurate information. So always providing accurate information that all.
And to piggy off of that, Abraham, too, like being honest is very important. And even if there are questions that you can't answer, be honest with them. Let them know, hey, you know what? That's a great question. Let me follow up with you. I'll ask our PI or our nurses or one of our doctors to get a more, legitimate answer for you. And I've had that situation happen to me before with me and my colleague. We've been at a tabling event and someone will try to challenge you and ask you a very tough, complex question. And it's okay to say you don't know. Like everybody's not, experts or medical doctors. So just know that keep that transparency and being honest, it goes a long way.
Definitely.
I'd also add like being consistent, right? Like not just dropping in with like a piece of information because, you're wondering if they're interested in joining the study. I think especially in this last year with all the blatant racism, police brutality, like it's a tall order to ask someone like, you're seeing all of this in the news, join this study. That is a tall order, right? It's not going to happen in an hour or in 30 minutes, 15 minutes. It could happen if you stick with it, it's not that we're trying to pressure anyone, but being consistent. And it is also a tall order because that requires lots of our time, right? Like lots of off the clock time when, you know, someone will text or call or email and have this question, answer the question, you know, like even after the study's over, or even after, you know, whatever your objective was met. There's so much information coming out. People, like someone was saying earlier, doesn't know what to absorb and what to trust. You are that person that they can trust, but you got to be consistent.
Yes, and also on Raphael, coming up with creative ways to like disseminate information. You know, like when you think about how technical something and technical and scientific things can be, you know, just being really creative and meeting communities where they are and finding like using social media the right way. You know, like people spend a lot of time on Instagram and Snapchat and Facebook. You know, just finding ways to disseminate information creatively.
Though that then makes me think of something, right? Which is something that I've been sitting on as I'm hearing you all talk, like this idea of the digital divide. Right now, like Dijamel was saying, right? Like lots of things are on Zoom, lots of ways of staying connected are virtual or require like technology. And like you were saying, Abraham, like not people have access to technology, but does everyone know how to use it? Does everyone leverage it? Right? So when I think of like my parents, for example, they don't even have a cell phone. They're just getting their information off of the news. And the news is wild. The way that the sensationalism, it's so wild. So no wonder they form some of the opinions and thoughts that they have. Someone that has the advantage or the privilege of accessing technology could really like refine their search, an answer to their question. And so sometimes, you know, it's like, yeah, you don't even want to talk to me, but it's because everything you're absorbing is this crazy sensational message that you're getting from the news. Yeah. It's like getting it from Wikipedia versus like a scientific journal or something that's more like reputable and trusted. So with that said, you know, I remember when we were first starting to do community engagement regarding COVID-19, before we even started working on vaccine studies, canvassing, right? Like pounding the pavement, really going door to door and letting people know like, hey, I'm a resource. I'm here if you ever want to talk. If you ever got a question, you could text that number, you could call that number, you could email me. Again, it's a lot, that's a commitment, but you know, being reliable, being consistent.
Right. And to piggyback off of Abraham about meeting community where they are, takes me back to my personal recruitment efforts that have been centered around education first, not wanting potential participants to feel like in order for you to get information that you have to then express interest in the study. There's no expectations in these efforts. I've hosted several virtual and one in-person socially distanced dinner and learn about either Mosaico and intro to vaccinology and immunology. So taking it to the roots to even make sure that people even understanding what is the actual product that we've been asking you to participate in the study for. And I think, you know, in having presenters that the community can relate to or that are community friendly is also very much so important. Someone that can translate and have the language that community speaks and not just all technical medical terms. And I've had really good response from that. And I think, again, that's just, it's really most important for me to give that information to people because, again, that's the root of the mistrust, is the misinformation.
Yep.
So giving accurate information, like you say, Abraham.
You know, what I'm hearing is that the process of building trust back up in your communities really requires going above and beyond your job descriptions. So, I mean, so fortunate to have all of you doing what you do for that reason. And acknowledging that there's only so much one person can do. What do your communities want sort of see happen? What else needs to be done sort of on a larger scale to build trust, do you think?
I think our leaders need to step up to the plate. I really am looking towards this new administration to definitely debunk a lot of myths and to talk about things that were not talked about in the last previous administration. That's really important. It's really important for our medical leaders to step up too. And we need that representation in all communities, not just African Americans, but Latino, Asian, and so on. So it's definitely important to have that representation.
I echo that completely. And not just like federal leadership, right? But like even local leadership, because that's a big difference. Again, here in San Francisco, like I mentioned earlier, Latinos, Latinx folks count as over 50% of local COVID cases. And the assistance that's offered is questionable, right? Like depending on what neighborhoods are being affected, like the resources, like food pantries and access to, just different job or financial support. It's been kind of questionable here in San Francisco. And I want to highlight here in San Francisco, this coalition was formed called the Latino Task Force. And it's a coalition of about 30 different organizations that serve many communities, but do primarily focus on the Latinx community here in San Francisco. And they've come together and the organization has been really, really tight. I'm not part of it, but I admire and respect what they've done. It's been really incredible to see how in coming together, all these stakeholders, community-based organizations, clinics, these different, folks that serve the same community, they've come together, they've gotten really organized and they've challenged the city. What are you doing? These are the resources that are necessary. At times, the city's come through. At times they've had to find alternative ways of gathering these resources to provide for the community. But local leadership definitely needs to step up in our respective areas too.
I want to, as we think about leaders, many times we think about elected officials, and we definitely want the administrations, federal, local, state, could all do better around this and also have a further coordination, but also we think about community leaders ourselves, making sure that we're putting out that proper information, making sure we're stopping those that are also expelling wrong information, harmful information, and also empowering and educating more to be able to do the same. I think that's an important piece of it. I think that is one of the things that we have to continue to do is organize and show folks what they can do, what those resources can be in order to switch up or change things. When I think about making sure our folks are properly, understood. We also, we going to engage our own leaders, and then also hope that there's also more engagement moving forward. It has to be a continued train the trainer almost aspect, even in this virtual space. And that also means in using some of our creative forms of media to also probably educate and get the information, proper information to folks. But going more to what our advocates, what our folks want, what our community wants to see is actually long-term change to make sure that this kind of stuff don't happen again. We also need systemic change when we're dealing. I remember Nana Connor said this, who leads PWN. We're dealing with 3 different type of pandemics: HIV, COVID-19, and the history of racism within this country. We have to do things that actually addressed all of them. That means dealing with healthcare. That means making sure that people have access to housing and affordable housing. We also have to deal with the impacts of COVID-19 in a racial equitable way. And I shout out to the administration for starting on that process, but there are ways to go that we have to, as a country and as a world, to deal with anti-Black racism and really tackling those issues. So when the next thing comes out that is disproportionate, when the next disease comes out that is impacting people, we have the proper resources in community to fight back and also protect ourselves and to protect even individuals, no, our community's economic interests, and not so like when our businesses have to shut down for a time period, community can still back and like know that, hey, we're gonna be okay. And at the end of this, when we get past this, when the vaccine's out, we can actually, and when we're getting the proper information, we can also go back to being a part of those spaces, coming together and enjoy it that much more.
All y'all should be in Congress. That's all I'm gonna say. I have one more question for you all.
I was like, you don't want me in.
Right. So I have one more question, but it's actually a question that came in online as well through Facebook. So I might as well pose their question. We're kind of going into that direction now. The question that was posed on Facebook is how can HIV activism and advocacy help to campaign for COVID-19 vaccine? And because all of you have such extraordinary experience in HIV and community engagement, I'd like to hear from you also about how your work in HIV has been leveraged in support of our COVID-19 response in your communities.
I'll say one way that we used like engagement strategies from HIV towards that of COVID-19. I think of like Early AIDS, ACT UP, Keith Haring, essentially what I'm referring to as activism art, right? A different way to engage folks, especially, given that there was so many businesses were boarded up here in San Francisco, like that was the canvas right there to engage people through an artistic meme, but with a message. And so when we started doing our community engagement regarding COVID-19, we worked with local artists to come up with a campaign that she referred to as like culturally responsive, something that folks that are being affected see themselves in different languages. So that's what I'll offer. Activism art, I think, is a really great way to engage community.
And Francisco,
yeah.
in my previous role, we spend a lot of time making scientific information very community friendly, right? So one of the things that I like to offer is FAQs and like documents that are really, really community friendly that start with the basics. As Djamel stated, like what is a vaccine? How are vaccines developed? Make sure that we are providing those basic fundamental things that others may know, but community members who have never been exposed to scientific information, they may not know that. So I learned that in my old job doing HIV work, just describing what is HIV, and making it as plain as simple, like the human immunodeficiency virus, So just making sure the information is really plain and simple for community, and that way they can disseminate it to others and they can understand it. That way they can understand it.
Yeah.
I'll speak to the question around what advocates can continue to do is speak to one of the things that I was saying was like, is for that next systems change, for getting our communities the vaccines that they need, that the proper research is done, and especially for people living with HIV, making sure that proper research is done for how in which COVID-19 impacts people living with HIV, but also how in which when folks are dealing with the pandemics or lockdown, how in which that is further impacting their communities. Also on the economic engine and how in which I know there's collecting information of how many people living with HIV are also impacted just by job losses within everything that just happened and the continued economic recession that will come from COVID-19. We have to also look within when I'm talking about one, healthcare access. We have to talk about getting people more access to care that is culturally affirming, that is giving the communities actually what they need around the care. I think it's advocating for more things where mutual aid, where the assistance around mutual aid is not so dependent on the communities that are already harshly impacted, but it's actually coming from a government assistance where it's coming from those that are extremely wealthy and potentially changing. So again, our healthcare, our education, our housing dollars are fully funded. I think those are things that our HIV activists can continue to advocate for. And I know that our Black Treatment Advocates Network will be doing on different levels across the country to do so. When I think about how in which we were also asked around the COVID response, there's a couple of things where I think about it. I sit on a global cab. I sit on a cab domestically, where it's talking about how in which what are the issues or reasons why Black people are distrusting of the COVID-19 vaccine. And I think what I have done and historically done in HIV spaces and will continue to do in most spaces that I'm in is say the things that maybe aren't the nicest or easiest thing to say, but need to be said in the room in order for us to make sure that our communities are getting what they need. As a person who also represents of communities that are disproportionately impacted by HIV, I want to always bring in those voices and thinking about what I'm hearing on leaders calls, what I'm having on one-on-ones, coalition meetings, and bringing that into those spaces, and being in BAI's unapologetically Black voice of saying, this is what our community is saying and that this is what is needed. On top of that, of also, giving folks the proper information of what's going on. And that means from a family level, community level, and to our larger network that we expand is giving proper information around COVID-19. Cutting through all the bull and giving the facts that folks actually need to hear about this is an important piece. And to also amplify the voices of those that are disproportionately impacted and thinking about how we're building and organizing for the next thing, or for what next we want our communities to look like. I think what our advocates focus on, but also just in community in general, to build towards something that we actually want to see, and is also can take on some of these hard punches, such as economic recession, but on top of pandemics.
Also, one of the important things to do in both HIV and COVID research is to stay connected and maintain healthy relationships with CBOs. Max, you talked about accountability with leaders in the community. So really informing the community leaders and CBOs to give out this information, or even encouraging CBOs to do testing. So like how we would with HIV, encouraging CBOs to do COVID testing, or even providing them the resources, just having them provide the event. You also spoke about cabs. So also staying connected with cabs and making sure that the cabs have their inputs, their experiences included in this process and this response.
Have we defined what cabs are for our audience?
Community advisory boards.
Okay. Thank you.
Good checking us on the acronyms. We can go acronym hazy sometimes.
Right.
I want to add a piece. I mean, certainly what we've done at the Leadership and Operations Center of the network has been transformative. I think one of the things that we've done that came from our HIV work in response to COVID-19 was leverage our relationships with the faith community. So, I mean, we already had a faith initiative in our HIV work with the HIV Vaccine Trials Network that was being spearheaded by Reverend Sanders out of Nashville. And so we basically brought that over into our COVID space and expanded it to include lots of different faith ambassadors around the country who are also sort of working with lots of different faith leaders in different parts of the country as well. So this is, I would say, one of the strategies that we've used from our HIV work in response to COVID.
And I want to bring in this piece because Kaida, a wonderful advocate who I have a chance to work with and just spoke to our We the People research cohort yesterday, one of the things that I definitely wanted to bring in was also expanding our base of who in which we're engaging. Stefan had just talked about the faith community, expanding who in which we are talking to within our religious leaders when we're talking about COVID-19, expanding who we're talking to around, because understand that this, we don't fully understand how in which who within our community gets impacted, but we know it is impacting our community. So even some of the folks that were not our friends before, bringing them in and saying, hey, we have the better expertise in this particular subject right now. Because of our years of work here, come with us so we can help all of our community, because there's some expertise you have here that I may not have, and together we can actually make a difference here. I think is an important piece for us that HIV has always historically done, that I think it was even compounded when dealing with the COVID-19 response.
Well said.
Yeah. And y'all, both of you have touched on faith leaders, and this is actually a question that came in, so I just want to make sure I point it out in case any of you have any other insights. The question simply is, how do you imagine that the church can help?
Yeah, so I guess I alluded to this, but I maybe didn't go into depth. And so certainly faith communities, faith leaders play a critical role in being a trusted voice for many people, many communities. So I think the church and all institutions of faith have an opportunity to share accurate information about what's happening, to engage their congregants and their members about how to protect themselves, about how to, ensure that they're adhering to the prevention guidelines recommended by the CDC, and that we are able to partner with that we're either able to partner with you directly, or that you're able to partner with somebody who's going to be able to give you perspective about what's happening with the science, so that you can relay that information to your members. I think one of the other things that I've seen some churches do is to open up testing opportunities for their members so that they can come in and get COVID-19 testing as a way to help respond to the current pandemic. I know some institutions are ramping up their food and sort of health and service ministries regarding other service needs. So there are some groups, I know there's a Muslim initiative in the Baltimore area that's ramped up their ability to provide food and other support services to their community and their members. One of the other things that's happening is that there's some conversations around churches being, vaccination sites for communities. These are places that people are often very familiar with, they go to anyway. So if there's an opportunity to provide support in that way as well, I think is critical.
And the churches can keep their doors closed on Sunday if they're not a testing or vaccine space, and not unless they're getting everyone vaccinated within. So, trying to make sure also that I've seen different churches be able to help support different folks who normally wouldn't be able to watch church from home, able to do so. Those, especially those that are most impacted, got to get that time in on Sunday. Just trying to making sure that they can do that from in a socially distanced way is also helpful and good to see. And all the good things that churches we've seen continue to do, which also give out food and the other types of support that folks do need. Those that can also give out housing support. I know different have access to that. Being able to do so and always giving their congregations the most proper information is the best they can do.
Makes sense. I have a question here that came in, actually specifically for Raphael. Although if anyone has any insight on this, you're welcome to also respond. How do you tailor your messaging to Spanish-speaking communities in the Bay Area, which I assume is diverse in their understanding of how clinical trials work?
Don't rely on Google Translate. That's for sure. It's one thing to like this idea of being bilingual, right? Like being able to translate a language to another language. It's a very different thing to be bicultural, right? So even the way you structure a sentence is not the same as it is in English, in Spanish. So having folks that speak the language, that are embedded in community, having multiple people review it for, different like reading levels, but definitely having like that cultural representation and touch involved in it, and not just relying on like a translating service or whatnot, or Google Translate, like I mentioned. That would be my biggest suggestion.
Thanks. Does anyone else work with multilingual communities at all?
Francisco, we do a little bit at Vanderbilt, but not much. We have a couple of Latinx community members, and we connect with them sometimes. I know my colleague will sit in on their virtual platforms just to be an ear and just to listen. Sometimes we won't even say anything, but it's just good to have that representation in the room.
Absolutely.
So that way we kind of know what are the needs for that community.
One thing I'll just say is, in a lot of the virtual spaces, and shout out to our partners at the Latino Commission on AIDS, about also having spaces where folks can have a translator and setting that up for the different virtual spaces that we're creating for folks. There are certain things that we could have done in person that when we're setting up virtual spaces in time and folks feeling comfortable, going that extra mile to make those spaces comfortable for folks no matter what they are, and folks can really come as they are and still get the support that they need is an important piece to do. And that also means in setting up sign language pieces when available for different conversations we're having and other things, especially when we have the time and the support to do so. Creating those spaces for folks so folks feel as welcoming as possible is always helpful.
Yeah, the Atlanta Ponce team is definitely being more intentional about focusing on the Latinx community as well, in which we just actually hired a Latinx person to who has that connection and that relationship with that community. So shout out to Humberto, who actually is the person who asked Raphael that question.
Mm-hmm. Thank you all. So that I actually don't have any other questions from the audience that are waiting. In which case, I think this would be a great opportunity. We have over 10 minutes left. If anyone has anything else that they want to talk about that hasn't been touched on yet, maybe I didn't ask a question that I should have. Any burning thoughts that you have on this topic today?
I will say something that makes me very hopeful about all of this, you know, in thinking about getting back to our HIV work, before explaining vaccines was a really complicated subject. It was hard to actually engage people in wanting to learn about it. And whether we like it or not, for the last like half a year or so, like we've been getting quite the crash course on how vaccines, like the process of vaccines, through all of this. So I'm hoping that, you know, once things start settling in, our HIV efforts never stopped throughout this pandemic, but we're definitely going to gear them up harder. And I'm hopeful that with this new information now that everyone has around like how do vaccines work, the conversation around HIV research and around HIV vaccines, can evolve a little quicker, honestly. So for that, ironically, I'll look for the silver lining and I'll thank, the powers that be for offering this new knowledge and information.
Right.
Francisco, I would say more than anything with the community advisory boards, I say to heavily rely on them a lot. I don't know what site or what you guys have as far as your community advisory boards, but I know for ours, we definitely give a lot of responsibilities to our CAB members because we know that this is just a job that we can't do by ourselves. So, try to have a good trusted person to continue to inform people, because this is a topic that we're going to be having for a long time and we can't do it by ourselves. So it's good to disseminate information to the right people and to the right places.
I might as well put a plug since we're talking about community advisory boards, because there might be people watching right now who never heard of that before. If there is an HVTN a study site somewhere in your area, that would be the place to contact if you're interested in getting involved in any way, including becoming a part of a community advisory board.
And a great way to learn about vaccines as well. So any apprehensions or things that you didn't know can definitely be answered.
Right.
I want to add, it would be a shame if we decided that at this time it would be just to go back to normal, or after things are over within COVID to just go back to those saying like, okay, we'll go back to this particular like way that we were doing things before. Stefan spoke of this earlier. Is like one of the things that when we think about one of the things that happened in Georgia was 2018. Folks were quite upset because they also felt like the election had been stolen from them. But it also allowed for us time and space to educate more folks around what this election meant, what type of election, why do we need to be connected to these processes. In the same way that COVID-19 in 2020 allows us to understand this is why we need to wear a mask or be social distance. Also, this is how vaccines work. This is why they are important. This is why this science is really important, and encouraging also more and more of our folks to also get into the field, understanding it and seeing more individuals that look like us. When we talk about, it was a Black woman that created the initial vaccine that we had. Those are things that we can also champion and talk through and talk more about with our communities and using as a way to get our folks more health literate, but also become also better health advocates for themselves, but also for community advocacy for better healthcare outcomes for all our communities. And I think that is where the biggest opportunity we have. And I want us to, but that takes initiatives, organizations, and spaces for us to bring together, to move that together.
Thank you. Well, I have one question that just came in, so this could be our last one. This question is, how would you approach a conversation with someone who is on the fence about the COVID-19 vaccine? People who are taking this sort of wait and see approach.
So Francisco, I can take a stab at this question. The first thing I would do is to ask why that person is on the fence, but also recognizing that they have a right to be on the fence about the vaccine. I think the worst thing you can do is try to force any product on someone, because that also builds more mistrust. So number one is to find out why. Secondly, respect the fact that they do have some reservations about taking the vaccine. And like I said earlier, providing them with the accurate information. If they say, hey, I'm worried about the side effects, make sure you provide them the information about the side effects. If they want to know more about how the vaccine is developed, maybe point them to the website that can provide them with information about how the vaccine is developed. But I think that in these times, it's important to recognize that people have the right to choose whether or not to take a vaccine.
Great point. Any other thoughts from those lead panelists still here?
Yeah, I guess I just offer like no pressure, you know what I mean? Again, going back to like just being a resource. Like, I'm not trying to convince you to do anything. If you have a question, I'll try to answer. If I don't have the answer, let me find you the answer. But I'm not trying to pressure you.
Right.
I think
Also,
that's really, go ahead, DJ.
Just real quick, I was going to say, fortunate enough that there have been several people who have taken the vaccine and actually documented it and have allowed us to follow that journey with them. So I would encourage to refer them to those people that they can see firsthand, sharing their experience with the vaccine.
Yeah, I was actually going to reference that. Up and down my Facebook timeline, I feel like I see lots of people who are getting the vaccine, and almost all of them are people of color. So I think it's interesting. I also want to acknowledge that, I sit pretty closely to the science on this, and my goal is always to help people understand and to enhance their understanding of what's happening with the science. I think science for many people is a mystery. And I think one of my colleagues said earlier about what people don't understand, they tend to fear. So I think for me, the opportunity that's presented in front of us is to work that much harder to take the mystery off of this, to sort of take the veil off and allow people to really see the behind the scenes and the mechanics and understand the intricate details of the process. But beyond that, I also want to acknowledge that I'm also a study participant. in the Novavax study. So I am, I believe in the science. I believe in what we're doing. And I think it's important to just say that.
Well, with that, we're pretty much running out of time. I want to thank you, all of you, the panelists, for your presence today, for sharing your expertise with us. I want to thank everyone who joined to watch. I hope that you enjoyed the session and that you learned something new. I want you to keep in mind that this is only the first episode in a 3-part series. The next episode, which is coming up sometime in February, is going to focus on how our work in COVID-19 vaccine research over the past year has in turn informed how we might move HIV research forward now that we've learned more lessons very quickly. And then the final episode will be a discussion about how we might reimagine our approach to HIV research and community engagement in order to ensure that HIV research remains important, visible, and responsive to our communities. So please be on the lookout for invites to those sessions. Our website is preventcovid.org. You can be up to date on everything there. And hopefully we'll see you again there. So thank you all very much for coming.
Thank you all.